welcome everybody. I'm very, very excited today. Our topic is exciting new advances in skincare formulations. And it's my great pleasure to introduce Dr. Belal Chami, who is a senior lecturer in biomedical research. He's highly acknowledged both academically and in the commercial world. And what is exciting is that he has introduced a new generation of antioxidant serums that operate on a whole different platform, a different modality, can be used in the industry, but that the way the serums work is quite different, and it's a new approach that is more modern and it's more up to date. So it is my exciting moment to introduce you today and to also welcome him. So welcome, Belal, and let's dive in to share with us about what does antioxidant synergy mean, because we know that there are lots of evidence-based ingredients, but the synergy of antioxidants is kind of the cutting edge of formulations now that are bringing a new level of cell renewal and cell regeneration in a more targeted way to the DNA. So I'm looking forward, and I'm sure so is our audience, to hear from you. So please explain, what does antioxidant synergy mean?
Thank you, Tina, for having me. And sure, I'm happy to jump straight into it. What antioxidant synergy means is this effect where we call it a 1 + 1 = 3. And it's where we harness the natural synergy of antioxidants when they exist in usually plants and plant materials as well. An example of this is things like quercetin and resveratrol. This is an example of two antioxidants that individually are not particularly good antioxidants. Resveratrol is described sometimes as a bit of a lousy antioxidant, but it's got a very powerful secondary effect on DNA. I'll talk about that later. But as an antioxidant itself, it's not particularly strong. And quercetin is a very rapid reactive antioxidant, but together they have this synergistic effect where combined the antioxidant potential is more than double their original. Mm-hmm. And that is tapping into a type of science that we are only starting to unravel, and how we can make that useful in topical applications for the prevention of oxidative injury. And so I guess that's what we mean when we talk about antioxidants. I think we need to think about antioxidants in the way they present themselves in nature. Antioxidants never exist by themselves. If you think of any type of fruit or vegetable, there is a concoction of antioxidants that are present. And it's not a coincidence. It's because those antioxidants in combination with each other have an additive effect that has been carefully curated through evolutionary, just through evolution, really. And so things like vitamin C and quercetin have a synergistic effect. Resveratrol and quercetin have a synergistic effect. And it's knowing that synergy and using that synergy is really something that we're only starting to use in topical. So we're starting to hear more of it now than I guess we ever have.
So really the new science is looking at how these, even though we know individually what these antioxidants have in terms of benefit, it's about making sure that when they are transferred into the body, that they actually do the correct task. It's about the delivery issue, isn't it? That's the new breakthrough.
Exactly, and that's the other part as well. Some of these antioxidants that we deliver either orally or topically can be enhanced by the addition of other antioxidants or other types of lipids. And again, the case, I stick on quercetin because I think it's such an interesting antioxidant that has a lot of research, and it's one of the most interesting in the aesthetics because it's heavily underutilized despite the massive amount of research that's available on this area. And quercetin is known to be terribly non-bioavailable, and when taken orally, it just doesn't get doesn't pass through the barrier when it's taken alone, but if it's mixed with certain things like other lipids or other antioxidants, it can enhance its delivery. And that's interesting because, again, quercetin is one of those antioxidants it's kind of fat loving, and it doesn't exist by itself in nature. It does exist in these concoctions of other cellular components that normally would make them more bioavailable anyway.
Yeah. So why have you taken the cellular approach to skin health rather than, in other words, what level of research are you allowing the new approach to improve cell-to-cell communication?
Yeah. Look, I think a lot of formulations take the approach where we are trying to address the secondary cause of aging, which is reducing reactive oxygen species. And certainly reactive oxygen species do cause aging as well. And so having a good antioxidant defense on the skin is useful, but it doesn't target the underlying cause. Aging ultimately is caused at the cellular level, which means that there's either a lot of injury to DNA. DNA is one of those, or DNA integrity is a measure of cell youthfulness and health. And over time, DNA damage begins to accumulate, and it's the accumulation of DNA damage that really is the cornerstone to a lot of aspects of aging. And topical formulations don't target that. At least the vast majority over the last 20 or 30 years. It's more other factors like reduction in hyaluronic acid production. And so we try to supplement hyaluronic acid onto the skin, or reduction of collagen. And we try to supplement, either try to stimulate those cells to make more collagen or supplement collagen. But it's not targeting the actual root cause as to why are aging cells producing less collagen. And how can we improve the cell health to make more collagen? And that is the real difference as to the approach that we've taken. Let's try to improve cell health, because ultimately younger cells behave better and they function better. And so younger cells have a better capacity to make collagen and make hyaluronic acid and make all the other components of the skin. And as they age, they start to make less of those components. And we're really trying to squeeze a dry rag here, get the most out of older aging cells. Well, the approach should be, how can we improve the health of cells so that they can, and support their health so they can do the normal function anyway.
Which is a very, very regenerative medical concept that if you remove the toxicity or the issues that compromise health, the body has the capacity to rejuvenate. So really improving the body's natural ability to renew itself is key to rejuvenation. It's not just imposing something, but also optimizing the body's capacity to function at its optimal, which I think is a very healthy thing, not only for the skin, but overall for the body. And it's very much a concept in integrative medicine. So we're bringing that into the skin. That's great.
Yeah, exactly right. We're touching on regenerative medicine here, and it's not just the skin. I mean, the skin is the largest organ. The skin is useful in the sense that we have an advantage with the skin that we don't have with other organs, in that we can deliver these ingredients at concentrations at such an ease, and at concentrations that are functionally useful than you could otherwise achieve in a systemic approach. Systemically, you have a lot of issues. Firstly, trying to get the drug past the gut, and then you have first pass metabolism issues as well. And so trying to get bioavailability and bioactivity of compounds is difficult systemically. But with skin, we had this unique opportunity to apply at very high concentrations your active ingredients, and they make them way into the dermis where they need to be, at a level that you simply can't achieve at the systemic dosage. So, taking advantage of that and really trying to revitalize skin health through improved function of I'll start the name, dermal fibroblasts. These are the key cell types that are responsible for maintaining the integrity of the skin. I think we're just scratching the surface. We've got a long way to go, and we've made a lot of progress since.
Mm-hmm. Are you, in order to achieve better penetration into the dermal area, are you working on the molecular structure of the ingredients, or is it just the combination that changes their capacity to absorb?
That's a really good question. And sometimes we have different approaches for different ingredients that we're trying to deliver. And some of those are complex. Some of those are complexing or creating these stabilized structures for the ingredient to get into the skin. So in those, cyclodextrin stabilized ingredients like resveratrol. Resveratrol is an example, is a really good example, because although we know a lot about resveratrol, getting that, there have been limitations in how we can formulate that topically, because resveratrol exists in two forms. And one form is the straight form, we call that trans, and the other form is where the molecules bend, and we call that cis. And there tends to be a lot of the most naturally occurring resveratrol is in the trans form. But when you apply it to a solution and to a formulation, it bends. It causes this isomerization reaction that's really rapid. And that's really important, because we know from the research that it is only the straight trans form of resveratrol that has the DNA protective effects.
Yeah, right.
The cis form doesn't. And so formulators have been trying to get this into a solution, and I guess maybe there's not enough attention into maintaining the trans form. So what we've done is complex this with cyclodextrin, these molecules that encapsulate and really keep the structure in its correct form, so that when it reaches the area of the skin, it is the form that it needs to be in for it to be active.
Excellent.
And this is one of those examples. And other examples are things like liposomal formulations as well. So I guess it depends on the type of ingredient we're trying to deliver, understanding the chemistry really, and the biology. It's a good case of biochemistry, actually.
Well, that's a phenomenal breakthrough, because it makes a lot of sense that it's no good just having the ingredients if they can't enter the pathway where they can create change. That's important. So what other advances can we expect in skin therapy in the next, say, 10 years?
Look, I think where we're heading is into an area called senolytic therapy. And it's an area, to me, that's very exciting. We're certainly doing our own due diligence into making sure our formulations fit that. And I guess to understand what senotherapy is, we have to understand what happens to aging cells. And when cells are injured, and that's because they've been injured either through UV light or they've been injured through environmental sources, they can enter this premature state of senescence. It's where the cell no longer is functional. It's still alive and it kind of hangs around there, but it's changed its shape, so it no longer looks like the cell that it should be. And specifically a cell type called fibroblasts. Fibroblasts are these cells that make all the things that we like about skin, collagen and hyaluronic acid and all the other structures. And they're very active cells normally. They crawl around the skin. They're very, very active. But when they enter a state of senescence because of injury, and sometimes the injury is induced by age, but sometimes it's environmental, and we're seeing a lot of cases of environmental damage, those cells no longer behave like fibroblasts anymore. In fact, they start to look more like fat cells, and we call those cells senescent. And it's a state that is irreversible. Once a cell becomes senescent, it cannot go back. And so the approach there is, well, what do we do about these accumulated senescent cells? They're not functioning and it's causing the effects of aging. Well, this is where senotherapy comes in. Senotherapy is where we get rid of those cells. And so we cause cell death of those cells that are affected by senescence. And that paves the way for new cells to regenerate and to take up the space of those cells that have died. so that really it's a case of regenerative medicine. And this is where skin therapy in the next 10 years, I think, will be heading towards. We'll be heading towards utilizing the principles of xenotherapy, and specifically speaking as senolytic therapy, which is where targeting those cells, destroying those sick cells to allow space for new cells to regenerate.
How does this synergistic relate to the sirtuin gene, which is the longevity gene?
Yeah, there is some relation to the sirtuin genes. Sirtuin genes are also known as the longevity genes. They're the genes responsible for repairing DNA, so that you have good DNA to begin with. The cells behave really well. It happens that those cells that are senescent, they don't express sirtuins very much at all. So I guess to answer the question, I think sirtuins are important, but they're not the cornerstone of premature senescence. Premature senescence usually occurs because of damaged cells, sometimes through DNA damage, and that DNA damage could be just like lifestyle factors, but UV exposure is certainly another one. Chronic inflammation, we're seeing a lot of chronic inflammation post-COVID in particular. And when a cell reaches a particular a tipping point, there's a tipping point of stress that the cell can no longer tolerate. And when you reach that tipping point, the cells become senescent. And that is the problem. If we're reaching that tipping point too early, then those cells and premature aging occurs. So I think it's a matter of rethinking what premature aging means. And at the cellular level, which is something that we don't really think about, but at the cellular level, it means cells no longer functioning because they're senescent. And the only way to deal with that is you have to get rid of those cells. And to do that, this is where the new research has kind of been focused on, is the senolytic therapy. It just so happens that antioxidants, quercetin is one example, but there are other examples. Antioxidants play a good role in eliminating those sick old cells. A certain combination of antioxidants work best. And we've been looking at the combination of quercetin with another naturally occurring compound found in long peppers. And this combination is theorized through very recent studies. Actually, one of the studies was published from a German institute, medical institute, just this year. This combination is theorized to eliminate those sick cells to make way for new cells to regenerate.
Yeah, so senolytic therapy is kind of the new breakthrough because it gives us a different perspective of how cells age. So, working with antioxidants that enable to protect the cell in their degenerative potential, I think is quite a breakthrough. It's very exciting.
Yeah. It's not just that. It's a new way of treatment. There are currently around 4 clinical trials in xenotherapies across very wide-ranging diseases: chronic pulmonary obstructive disease, dementia. I think there was another one on cardiac disease. They are all age-related diseases. And the interesting thing about those studies is that senolytic therapy is an interval therapy. It's not something you take for the rest of your life. It's a 2-week administration.
Okay.
And so that paves the way for it to be applied vastly into clinics. It's part of the treatment strategies as well. And so it's kind of like it's an on-off period. You do your therapy for 2 weeks. Some clinical studies only do it for 5 days. It varies, but 2 weeks seems to be the common number. You purge those cells, you resume, you come back again after 6 months, you do it again for 2 weeks. It's a different treatment strategy altogether. It's very targeted. So I think there are a lot of things that we need to consider in the industry when xenotherapy becomes mainstream treatment, on how it's best delivered and how is that delivery done. Is it done in the clinic with specialized equipment to get those molecules deeper into the skin? And that seems to be a logical way, actually.
Now, there's another interesting thing, and that is you are taking a minimalizing approach to skin routine. Can you expand on that? What do you mean by that?
Yeah, so this was an area that if I felt, and it's kind of outside of science, but it has some basis in science, where the 10 or 12 step routines were simply impossible to maintain. And it was also wildly unnecessary. Formulations that are well thought through could really cover a lot of the steps that are required. And so our difference was, can we really put together a formulation that contains a lot of active ingredients that work in a synergistic way to eliminate unnecessary steps? And that was the approach. You know, how can we make skincare more sustainable, skin health more sustainable?
Yeah.
And the current 12 step was simply just, it just didn't meet the sustainability mark. And both from usage and the environmental impact that it had, it was just something that was, we thought, perhaps a fad that will be replaced by better practices.
So are you saying that the minimalism is coming in the nature of a formula or the steps that you do in skin therapy?
It's the nature of the formula.
Nature formula.
Yeah.
Well, I would think if you found a mechanism where something is going to work effectively, it would contribute that you don't need as many components as in the past, correct?
That's exactly right. And that kind of circles back to the antioxidant synergy, is getting the most out of the formulation, getting the most antioxidant bang, if you like, without having to have multiple different serums.
So does it mean that the end product is going to be purer? It has more purity to it because it's not as complex?
It certainly is the case. You have more activity, bioactivity. And so that, and again, it has to do with things. Formulations are very complicated because you have one hand the active ingredients you're trying to deliver, and then your delivery agent and vehicle to make sure that those things get where they need to be at the right dosage. And if you can balance those two in a way that eliminates the need for other products, I think it makes it so much easier for the end user really to sustain.
That's great. So tell us now, how have you taken this research and introduced it into your own brand, your Redox Skin Lab? How are your formulas now reflective of these new advances?
We've always had, because my background is research, so it's always been a research to market philosophy. I think that's the philosophy of the brand Redox, and that opposes the current philosophy of market to research. And what I mean by that is that often there's a good deal of market analysis as to what the common buzzwords are for ingredients, and then working backwards with formulations to deliver those buzzwords into the market. And that in that space, there's no room for innovation because it's more or less of the same thing. And so our approach was always, let's look at what is trending now in the scientific literature. It may not be an ingredient that is popular in the industry because it's so novel and new, but that is where we need to be. It is what is the most supported, the most newest trending, well, not trending, scientifically valid ingredient.
And that's where education comes in. Yeah.
Education comes in. And so, introducing those ingredients is novel. Things like methyl vanillate, for example, which very few people might have heard of, which I suspect in the next 10 years will be wildly popular. But at the moment, but we have to introduce education. So part of the strategy is, okay, we can introduce new ingredients and new ways of delivering them, but we have to have a platform for for reaching out and educating on what those are. And so we've started a few channels of some of those via Instagram, and that's been our journey so far.
Well, it's very exciting times, and it's always good to have new breakthroughs because the consumer have the appetite for improvement and quick results is just quite phenomenal. And I think the efficacy of formulations is going to be critical to consumer satisfaction and for them to trust us. So I want to congratulate you for all your hard work and wish you all the best. And we are delighted to continue to profile your knowledge through our organization, and we always value your articles also in the journal. And breaking into this market is quite challenging because there's so many brands and so much noise going through social media, and it's about people taking a step back and understanding and being able to recognize that this is a new approach and it requires a comprehension of it, so they must dedicate some time to education. Being an educator, that's highly beneficial because you're able to articulate the scientific information, helping people to understand how these new advances can help improve the incredible amount of inflammation that skins are now experiencing. There's a lot of inflammation that we are being reported to us with the potential for reactions, and also high inflammation, as we know, if it's consistent, it's going to contribute to aging. And not only does it contribute to aging, but even if you achieve excellent results, you can't sustain them, because if there's high inflammation, it's going to dismantle all your work. So the longevity of the results aren't going to last as long. So I believe that understanding this senolytic therapy and also the mechanism by which you're working with antioxidants is going to provide some valuable breakthrough for treatment results, consumer satisfaction, and really credibility of the aesthetic industry as a whole. So that's really, we're very, very honored to have your knowledge and to share it through the industry. And I want to thank you for today. And I'm sure that we will be promoting this information through our YouTube channel, but also through other means. So thanks Belal, on behalf of the industry, for all your hard work and your contribution to aesthetics.
Thank you so much. It's been an absolute pleasure. I look forward to contributing more in whichever capacity I can.
Thank you.
Thank you.
Bye.